Construction and renovation is the seventh FMES program. Inevitably, there are construction and renovation in the premise that can be done as necessary. With this, the construction and renovation program is present, which aims to reduce risks associated with construction, renovation, or demolition project or a maintenance activity that may affect the quality and safety of patient care. Let's familiarize ourselves with the assessments that are necessary when construction and renovation are conducted. First is the internal risk assessment. A pre-construction risk assessment, also called as PCRA, ensures safety prior to construction proper. Before the implementation of an approved project, a meeting is arranged with concerned stakeholders to discuss possible risks that may affect occupants, especially patients, to assess and prevent occurrences of unwanted complaints and incidents. Potential risks are determined as seen on the screen. As you can see, this is the pre-construction risk assessment or PCRA form that is used to document the assessment that was discussed earlier. And here is the continuation of the PCRA form. You may pause this video to view the inclusions of the form. The assessment for safety does not end before the construction. During the implementation of construction and/or renovation, the infection control risk assessment is conducted. To ensure that adequate infection control and pre-construction risk precautions are in place and strictly enforced, as identified from the PCRA, the construction area are inspected by the Infection Prevention Control Officer. This is also to ensure that infection-related issues are addressed. The Interim Life Safety Measures Risk Assessment, as conducted by the project manager and FMED safety officer, assesses the impact of the project to occupants, adjacent areas, especially to the patients identified using the ILSM checklist. As you may notice, all parts of the activity is ensured to be safe through all required assessments. Under risk reduction strategies, all identified risks from the pre-construction risk assessment, infection control risk assessment, and interim life safety measures inspection are monitored and addressed by concerned units through the provision of clear, applicable, and effective measures that would prevent risks from happening. Now, should these safety precautions be violated, specific measures are done. For instance, a notice to explain and/or notice of violation is issued to safety violators. All violations have corresponding penalty or sanctions based on the Code of Discipline of MMC, if employee, and penalties for contractors written on the penalty matrix of this program. For the penalty clause, contractors are penalized if fail to meet the requirements during construction activity. You may pause the video to see the penalty amount per category. Now, let's move forward to the stages of construction. First is the schematic design. It includes complete and standard description of the building systems, such as architectural design, structural, electrical, data and telephone system, mechanical, fire alarm and protection system, sanitary, and environmental. Of course, let us not forget the documentations needed for project plans. All project plans, specifications, and related documents are submitted to the MMC FMED for review and approval, in compliance with the applicable local laws, regulations, and hospital policies. Examples are plans, permits, bonds, insurances, etc. And when applicable, contractors process the regulatory permits as seen on the screen. Moving on, before any kind of construction or work is done, a work permit must be secured. But before a work permit is secured, respective workers should undergo the workers' safety orientation. This said orientation is a prerequisite to the workers' permit. It is established by FMED safety officers with the objective to educate all workers who wish to conduct renovation, construction, and/or installation inside Makati Medical Center that would immediately align them on the safety, infection, emergency, and other related programs of the hospital. Strictly, no safety orientation, no work. Now let's go over the measures during construction and renovation. First is the safety guidelines overview. You may ask, why are assessments, inspections, and different processes conducted? This is because safety of all members of Makati Medical Center, as well as the community, is a major concern of the hospital. Thus, safety policies are always observed. Next is the access to MMC for contractors or workers. All contractors are required to submit NBI clearance of all their workers to MMC FMED. All are required to wear their company-issued IDs and could present any of the valid IDs as seen on the screen. Lastly is the infection prevention and control inspection. Infection prevention and control compliance is evaluated to ensure the compliance of contractors to infection prevention and control strategies. Moreover, here are other safety measures conducted to ensure safety within the construction area. You may pause to familiarize yourselves with the system. Other necessities during the construction are ID, PPE, and construction schedule. Last is the post-process of construction and renovation. Let's go over the punch listing. The punch listing activity evaluates the conformance of work to contract or plan specifications of the entire area using the punch listing form prior to the processing of the contractor's billing or the turnover to the project team or end user. Lastly, after the construction, here are the requirements needed. You may pause again to familiarize yourselves with the documents. The last FMES program is the emergency preparedness. This will be discussed on the next topic.